Hello, beautiful people. You are live on a brand new episode of Ladyz Digest, where issues in the world of women are discussed. Ladyz Digest is proudly brought to you by AAU TV, the voice of higher education in Africa. In today's episode, we'll be discussing family planning. And according to the United Nations Population Fund, family planning is one of the 10 biggest public health achievements in the 20th century. It is also a very, very fundamental human right. It also helps in reducing the risk of poverty and also helps in the move for the gender equality. Remember, you can join us on our social media handles at Ladyz Digest on Instagram and on Facebook and YouTube at the Association of African Universities. After this time out, we'll meet our guests. Welcome back from the short break, and as I introduced earlier on, we are discussing family planning, and I have my regular guest with me, Dr. Kwadwo Owusu-Ansah, to help us digest this issue. Welcome, Doc.
Thank you.
How has your week been?
Oh, it's been good.
Oh, okay,
Very
thank
good.
God. Yeah. So today we are discussing family planning.
Yes.
And I've done a very, very brief, just an introduction of the word family planning according to the United Nations Food and Population Fund. But I would want to know, as I always say, for the lay person, if I come to you, how would you be able to explain family planning, the word family planning to me?
Okay, so family planning broadly refers to various interventions or methods that are aimed at, first of all, preventing pregnancies in a way that a pregnancy is by choice, not by chance.
Choice, not by chance.
And the ultimate aim would be to space out the births in a family and then reduce the number of births. So ultimately, it will aim at reduction in population or population control, which also helps in the long term for nation development. So you know you have a regulated amount of people, you have to look over a certain number of years. So yes, so there are various interventions that try to control birth or pregnancy. The same as contraception as well.
Okay, the same, So I would say that those are the basic goals and objectives.
The basic aims,
Oh, okay. So if I come to you as a lady, as a couple with my partner, what are the different methods of family planning, and what are the, I know there wouldn't be maybe the best method, but what are the things you would consider in selecting a particular family planning method for me? So I want to know the different methods and the factors that will be considered when selecting a particular method for a particular couple. Okay,
so first of all, there's the natural methods, which just take advantage of the fact that a woman is not fertile all month long.
Sure.
She's fertile for about 3 to 4 days, maybe 5 days in a month. So those are the other ones. And they have the modern methods, which are usually some chemical based or some scientific or medical intervention. So we have the hormonal base, which are just using estrogen and progesterone in form of either pills or injections, or in the form of an implant under your skin. Or we have that one, and we have the barrier methods, where basically condoms, which mechanically prevents the gametes or the sperm and egg from meeting. Then we have the long-term ones, which can give you, so these are the condoms and the medications, hormone medications are short-term.
Short-term,
and then we have long-term ones, which are maybe intrauterine device.
The IUDs.
IUDs, And then we have permanent ones, which means that you won't have babies naturally again. So those are the main broad categories. With regard to what would influence a choice, there is no perfect method. However, there's a method for everyone.
Definitely.
So what happens is that you first of all need some counseling from your doctor.
Yeah.
And they will start by, first of all, knowing what you know about, your knowledge about it already.
Okay.
If you have a previous use or exposure to it. Some people have used some method in the past. Even if it's natural or modern method, something in the past, that one. And then we'll get to know for what time duration are you looking at.
Okay.
Or maybe medically it's recommended that you hold conception for a certain period, particularly if, let's say, comorbid medical conditions, maybe diabetes has not well controlled, or hypertension has not well controlled.
Okay.
We want to delay conception
Okay.
before. So there are scenarios where it will require that you have to take an intervention to prevent a pregnancy.
Okay.
Okay.
Yeah,
So
sure.
those are the factors that will be considered in the counseling session. Then again, you'll be counseled about the mechanism, how it works,
Okay.
the advantages of it, okay, the duration that it will be. So if you're looking at, if somebody wants to withhold pregnancies for, let's say, 3 years,
Okay.
you factor that vis-a-vis her presentation or her clinical history, and see what. Then finally they tell you about the side effects.
Okay.
What to expect if you are using it. So
Okay.
generally that's what goes into providing a method.
Okay.
Then after it's been provided for you, there's a follow-up period to see how well it's going, if you have any concerns,
yeah,
anything, up to a certain period of time. Yeah.
Okay, so I guess there's some of the side effects, or there are some cases where the side effects can be managed, or with the hope that it would maybe reduce, or there are times that if the side effect is too complex or too bad, they can remove it or try another method.
Well, it depends on the method you are using, but generally we counsel you about side effects so you know that it's something that can occur.
Okay.
And sometimes if it's a mild side effect or mild degree and you've been counseled about it, you probably need just reassurance or nothing else.
Okay.
Because usually it's for a phase, it would ease out after some time. So yes, if you are counseled well, you handle it better.
Okay.
You know,
Okay.
yeah.
All right. So, at what point should a couple, if I don't know if it should be before marriage or after marriage, at what point should a couple seek or consult their gynecologist for this? I know definitely it should be pre-conceptual period. So, at what point should they consult their gynecologist with regards to family planning?
Okay, well, it depends on what the couple wants.
Yeah.
Some people, soon after getting married, don't have childbearing in the immediate plans.
Okay, that's
so
true.
Yes, the couple can then seek out some contraceptive method to delay childbirth for the period. But typically, the discussion for family planning starts during the antenatal care. Someone is pregnant, and then we start. Most people who are not pregnant, never been pregnant before, are not very open to the contraception part, particularly if they are married. Because they are culturally they are looking for a baby, so contraception will not sell much for them. But usually, the WHO recommended time interval between births is about 2 years. Where you fully recover from the effect of the previous pregnancy. Particularly if you have complications, your blood pressure went up, blood sugar went up. You need to, the system has to recover in a way before you go on to another pregnancy. So then, contraception is actually for everyone in between pregnancies, ideally. So the counseling and the discussion for you to choose a method will start during your antenatal care. And then probably from your last trimester, discussions will start. And then childbirth will come. There may be one first visit postnatal, the discussion goes on. Depending on if you still have questions, you haven't decided. Some people decide by childbirth that, look, I want this method. So right after delivery, before you leave the hospital it's provided.
Oh, okay, I see.
So,
just after birth.
Exactly. So it depends on how the discussion goes and then what you settle on. Some people too will need maybe 2 or 3 postnatal visits. They'll finally decide I want this. Some people also get counseling, never choose any, and then come back pregnant very soon. So there are different outcomes.
Okay, I see. So you mentioned some people leaving the hospital and they've done it. So it doesn't in any way distort or affect breastfeeding or?
No.
Okay.
Usually we factor all that
Those
in
before.
making the choice for you.
Okay, that's very true.
So usually that's not.
Okay. So also as a side effect, I remember the case of a lady. I think she used the implant, the IUD, for I think 5 years or so, and she had just given birth, and she went she had it, and she started having this irregular menstruation. She can have menses like twice a month, and the bleeding was very serious, quite, and it was draining her. I don't think that would be a mild side effect. Would that be?
Well, it's a known side effect. So typically, the hormone-based methods, let's say what she had was the implants.
Yes.
So the implants, the pills, the birth control pills that we take, and then the injectable, the 3 monthly or monthly injections. Okay. They all, because of the hormone content, they all tend to give you a few side effects. Notably, is the headaches, the mood swings, weight gain, and menstrual irregularities. These will counsel you that this was going to happen. Now, it depends. Yes, sometimes the side effects are the reason why people discontinue the method over some time because they can't deal with it. But usually, it's recommended that once you fit it, we counsel you before that. So when it does start, you need to go. Remember, I said there's a follow-up period after you've chosen a method. So during that period, all we are looking out for is how well it's sitting with you in terms of you handling the method. Then you discuss with your provider, whether a nurse or doctor, that this is what you're experiencing. They would observe, depending on the severity, they may want to wait out and see. Or if it bothers you that much, they may stop that method and counsel you and provide another method.
Okay, so let's dwell a bit on the natural family planning method. How is it carried out? How is it done? What are the do's and don'ts and the precautions to be taken?
Well, natural family method usually presumes, so the presumption is that you must have regular menstrual cycles. Okay. So that you can predict where your ovulation period is. That's like a prerequisite. So when that is done, usually there are several ways to it. People use, you could use a simple, this is the apps on your phones to help you. You input the first day of your flow, and they will calculate the dates for you. By 3 months, it gets the pattern right. People use also called cycle beads, where they use the beads to check the length of your cycle, to know when they are safe and all that. So what it does is you just have to know when you are safe and when you are not safe. Okay. Then you can time intercourse with when you are not safe. When you are safe, to prevent pregnancy, and you avoid intercourse when you are not safe. You could use other things like people use maybe their body temperature first in the morning, basal body temperature, to see when they are ovulating, so they can avoid or use cervical mucus, the consistency of it, to see if it's thin and stretchy, you know you're ovulating. So that's the period where you avoid. You could also use it on the flip side to achieve conception as well. So depending on what how. So it's just using body natural signs. So it's natural because there are no external devices or medication or interventions involved.
So on a scale of 1 to 10, how should I say effective will this method be, or will it depend on individuals?
Yes, it varies. The outcomes varies because you see, with every family planning method, there's something called typical use and a perfect use. The perfect use of a family planning, the perfect use is always much higher. The percentage success rate. The typical use is lower. The reason is that the perfect use presumes everything, all situations perfect, nothing, you know. But if it's a user-dependent method, like say the birth control pill, you need to take it same time every day, in order to achieve the efficacy you want.
Yes.
A few hours delay could lead to ovulation and then failure and then you conceive.
That's true.
Exactly. So the perfect use presumes that the person is that religious and meticulous with the time.
With it, yeah.
Which really is not practical.
Exactly.
With most human beings. So, depending on how, if the method is a user-dependent method, then the typical use becomes what you look at.
Yeah.
Typically, how some people take maybe 2 pills a day or miss 1 or 2. That's what in reality happens.
Okay.
But the advantage of the other methods like the implant, the perfect use and the typical use is almost the same. Because the human factor is sort of taken off.
Yeah,
you have a device that has a hormone loaded into a silicone implant or shell inside your body for 3 years. It works 24/7.
It's working for you.
Exactly.
You
so your own interventions are not part of it.
Yeah. Okay.
So that is likely to be more effective. Than a pill that you were taking every day.
Yeah. And also, I think our bodies even change once in a while. And if, as a lady, you don't even understand your body, it may not be safe to go for the natural
well, the natural presumes that you are very conversant, so you can predict your ovulation.
Okay.
If you are not the regular person, maybe your cycle can skip 2-3 months. Then that might not be for you.
Yes, sure.
So you need to know who you are and then for your setup.
Yeah. Okay, still on the natural method. Is this method accessible, or will it be accessible to every couple or every lady, or would there be some exception, maybe because of medical conditions or something? Would there be?
Well, usually at counseling, they start with that before they bring in the modern methods. Okay, so we will be told what to do. It has an appeal with some religious people.
Yes.
Because they don't feel certain devices
it's a sin.
are not exactly. So that's a big advantage. It has more religious and social cultural acceptance
that's true.
than the other modern methods. That's a big advantage for the natural ones.
That's true.
So usually you have a discussion with them and then you get to know a preference from the couple that, we prefer that. But technically it's for everybody. But the big underlying thing is the couple must be well motivated.
That's true.
In order to have the outcome that you want. Because it's a natural thing. Willpower plays a huge role here. So if you are not willing or you are not so much paying attention to a few things, you could have the outcome you don't want, which is a pregnancy.
That's true. And everything will be
So even though it's culturally very acceptable to a lot of people, you need a well-motivated couple to really get you the outcomes.
Follow it religiously and that's true. Okay, so we'll go for a quick break. Hey people, this has been Ladyz Digest. In case you're just joining us, you can join us on our social media handles at Ladyz Digest on Instagram and Facebook and YouTube at the Association of African Universities. We'll be right back. Welcome back, people, to Ladyz Digest, and I'm still with my guest, Dr. Kwadwo Owusu-Ansah. So, Doc, this one is before we continue, I want to know if it's a myth or a fact. Is breastfeeding, or can breastfeeding be part of the natural family planning?
Oh yes,
it's
one of, we call that a lactation embryo method. So what happens is that if a mother delivers and is breastfeeding consistently and on demand. Emphasis on consistently and demand. Usually, certain hormones are high enough to prevent ovulation.
Hormones,
So, in about 90% of women, that can prevent ovulation for about 4 to 6 months.
Wow.
From the time of delivery. It doesn't work everybody. You could do it as intensely as you want.
Like the baby-friendly thing.
As by
every
6
time.
weeks, 8 weeks, your period will return. Once your cycle returns, you are fertile again.
Wow.
So, but in most women, if you do it religiously, you get benefits for the 4 to 6 months. You're not likely to ovulate or have your cycles as well. So that gives some benefits. But after 4 to 6 months, its efficacy begins to wane. So you will need alternate methods in order to continue.
Okay, so it has to do with the hormones.
Yeah.
Yeah, because I know, okay, then I think we hear that the men feel that the women are breastfeeding, so they can't come close to the woman to have sex and all that. So I guess that's what I used to hear of then. Like,
because of, well, I think probably other factors may have been culturally. Usually when you deliver, you leave home to your parents. So for some time, so probably that contributed to that.
And they felt
that exactly, but that shouldn't be the cause.
Yeah, that's true. So that means it's a fact that it's.
Oh yes, yes, it has some benefits.
Some benefits. Okay. So can family planning help in any way to reduce STIs or any related diseases?
Yes, so STIs, usually the method that works best for STIs is what we call the barrier method.
Barrier, okay.
Okay, under which you have the condoms, the male condom and the female condom. Okay, so these are made of some form of rubber, or, you know, and then maybe latex or polyurethane like rubber. And it helps prevent, so it would prevent the gametes from meeting. That's the contraception part. Sure. And also prevents body fluid exchange or contact.
Yeah, yeah.
Okay, so yes, for STIs, the barrier methods are the 1, 2. The rest do not prevent STIs.
Okay. So let's talk about the side effects. I know each method would have its associated side effect, but what are the general side effects of this family planning, or you can help with for this natural method? These are the side effects for the IUD. What are the side effects for
natural? Usually may not have any side effects because it's your body.
Okay, that's true.
Invest has a high failure rate.
Yeah. Because
of, as I said earlier, if you're not well motivated or you're not paying attention to your cycle pattern, then you may miss a few things. So it may not have much side effects with the natural.
Okay.
The side effects comes with the modern methods. So top of the list, usually the hormone-based methods are the ones I mentioned earlier: the weight gain, the mood swings, menstrual irregularity, headaches. Those are the main ones. So we have the pills, we have the injectables, 3 monthly, 1 monthly. We have the implants under the skin. Those are probably the, I won't say problematic, but the most
with the most
complaints. Then we have the intrauterine device, which may also give you slightly heavy periods. Some will complain of discharges here and there, and the cramping, particularly if it's fitted the first few days. So those are and then maybe some expulsions over time. For example, the IUD, you know, it may expel itself or migrate. Those are potential complications. It doesn't happen often though. With that group.
So we've been talking about the woman. How is in any way can a man also can they also are there ways or techniques for men too?
For men, we are looking at first of all, abstinence. If you are not doing anything, that happens. They have condom use, which is the most common for method available for a man, and it takes a well-motivated man to use a condom anyway. So that's also another challenge. Then we have the permanent one, which is vasectomy, where some of the spermatic ducts are cut. So that is permanent. So it takes a lot of counseling and mental preparedness to go through that process.
Well, okay, for that, maybe some side effects would just be the pain initially.
Or initial pain, that's about
Yeah.
it. But after that, it's fine.
Okay, I think there's also withdrawal. That one, it still takes a self-motivated
Yes,
man
so
to.
the withdrawal too is another one. It's part of one of those natural
Yeah, and
but
it's
then yes, also
self-motivated.
self-motivated. So those natural ones require a very well-motivated person
Yeah,
to get the outcomes.
that's very true. If not,
And that's what makes the failure rates high
higher.
and less reliable. So then if you really want something to work, you are likely to look at the other methods,
Yeah,
which
yeah.
may be more efficacious. Yeah.
Okay, so I'll just read, this is our final one. I'll read the statistics from the UNFPH, which is the United Nations Populations Fund. It says that in the developing regions, an estimated 217 million women who want to avoid pregnancy are not using safe and effective family planning methods. So as a gynecologist, how would you enlighten us on some reasons or challenges causing the use of unsafe family planning methods?
Okay, so I think it's looking at what we call the unmet need of family planning,
Okay.
where women who are in that reproductive age group wishing to
Exactly.
have contraception or prevent pregnancy are not using a method for one or two reasons.
Okay.
And usually it could due to the availability of the method, the social cultural acceptance of it.
Sure.
Sometimes it's the cost. Okay, maybe it's available, but it's expensive. Okay, so the key things are the social cultural acceptance, the availability, and the cost. Those are the key things, because sometimes it's available, but there's a whole, I won't say stigma, but there's a whole perception of the society about it.
Especially if a single lady is going to the hospital.
Exactly.
And you say you want it.
So that takes a lot of education and the counseling. That's why the counseling part is very important, because most people walk through your doors with a lot of misconceptions about family planning.
Yeah.
That you have to slowly discuss with them and dismantle it in a way in their minds that it works and everything.
Yeah.
And sometimes they over focus on people's bad experiences.
Yeah.
So in their minds they have a whole long list of bad experiences of all their friends, and never look at the plus, which is the fact that prevented pregnancy. Exactly. So that the counseling takes away. So you have a full open discussion in a very safe, maybe professional, discreet manner with all privacy applied. Then you explain to them what it does, And sometimes you look at the big picture here. You may have minor issues, but on the whole, it will help you, put you in control, so that there are no surprises.
Exactly.
You get pregnant when you want to, vis-a-vis the effect of raising children in modern economic times and all that. Yeah. So the unmet needs usually from the availability, the cultural perceptions, and the cost of it.
Yeah,
but generally, now a lot of donor agencies are funding the family planning thing. So it's available at not so high prices.
Okay, not so high prices.
And most centers, most hospitals have it. You can just walk into a center and then ask for it. If it's not that, you can get a nearby center that provides it. Most people with maternity services has a family planning units as well.
Yeah.
Also there.
Sure. Yeah.
So it makes it's available all over. Availability in this country is not a problem, unless in very remote areas. But in most urban cities, towns, family planning is available.
So I think we should work more on the acceptance. And
so our biggest challenge is the acceptance.
Acceptance.
Because you tend to see a lot of people who know I'm not ready for a pregnancy and are very reluctant to use family planning as well.
That is it.
Yes, also, and the reasons are sometimes hard to try to decipher why they can't.
Yeah.
But there's this deep misconception with mistrust for the methods.
Methods, okay.
So it's that's the thing. So usually they would, I'll use a natural one, and then Because a natural requires a motivated person. Along the way, they fail.
They fail, yeah.
Then, you know, we are back to
Yeah.
where you don't want to be. Exactly.
And I think some also depend on, or they rather fall on the emergency
Exactly.
pills,
So there's a lot of
Yeah.
reluctance to use a proper method. But you see, if you find yourself using emergency pills on a regular basis,
Yes.
which then means that you have a need for a longer term contraception.
That is it.
You know, but I've seen a lot of people who.
And what's your take on that? That emergency pill, is it really proper? As in for regular? Because that's why I know it's emergency.
Emergency pill is just as the name says. It's an emergency. So it's for the scenario where you probably were ovulating and you had unprotected sex and you want to prevent a pregnancy.
Yeah.
That's about it. It's not meant to use repeatedly.
Daily or even weekly or something.
No. So usually what happens is that repeated use will alter your menstrual cycles over some time because you're introducing hormones at certain very frequent intervals. So usually once you are using emergency pills on a regular, you need proper counseling to look at another method.
A better method,
But emergency is emergency. It does not in any way replace
the different
a definitive contraceptive method.
Okay. Thank you very much for coming around today, and I guess our audience have really gained a lot because I think this is a very important topic that people need to know about. So I really appreciate it. Thank you very much. This has been Ladyz Digest. In case you just joined us, you've not missed anything, you can always go back to our social media handles to watch this clip because it's a very important and enlightening production we had. Many thanks to my production team for making this production a success. I've been your host, Joan Interacts. Bye.